Alright, today we're going to go over Fundamentals Exam 5 Study Guide. It's the last thing we got to go over, so we'll include infection and sleep. Let's jump right into it. So, how is lab testing done for Mercer? Broth microdilution testing, sulfoxetine disc diffusion test, or oxacillin in agar with NaCl, nucleic acid amplification test. Be able to describe Mercer surveillance systems and programs. Describe cleaning techniques for Mercer and why they do or do not work. Mercer can live on surfaces like towels, razors, furniture, and athletic equipment for weeks. Hand washing or using hand sanitizer that is at least 60% alcohol is effective. Disinfectants that are effective against S. aureus will work on Mercer. Surfaces that look clean may still have germs, so barriers may also be used. White blood cells. Tell me about neutrophils. 50% white blood cells, first to respond to an invader, sends out signals to other cells. Tell me about eosinophils. Very important in responding to parasites and worms. Cause allergy symptoms. 5% white blood cells found mostly in the digestive tract. Tell me about basophils. 1% white blood cells, non-specific response to pathogens, role in asthma and causing bronchoconstriction or release histamine. Tell me about lymphocytes. Tell me about B lymphocytes. Responsible for humoral immunity. Tell me about T lymphocytes. Directly kill invaders. Tell me about monocytes. 5 to 12% white blood cells, garbage trucks of the immune system. Tell me about innate immunity. Provides the early line of defense against microbes. It consists of cellular and biochemical defense mechanisms that are in place even before infection and are poised to respond rapidly to infections. The mechanisms of innate immunity are specific for structures that are common to groups of related microbes and may not distinguish fine differences between microbes. Tell me about adaptive immunity. The defining characteristics of adaptive immunity are the ability to distinguish different substances called specificity and the ability to respond more vigorously to repeated exposures to the same microbe, known as memory. The unique components of adaptive immunity are called lymphocytes and their secreted products such as antibodies. What is an infection? The invasion of a susceptible host by pathogens or microorganisms resulting in disease only occurs as pathogens multiply and alter normal tissue. What is colonization? Presence and growth of microorganisms within a host without tissue invasion or damage. What is a communicable disease? The infectious process transmitted from one person to another. What is an example of an asymptomatic communicable disease? Hepatitis C. What is symptomatic? Signs and symptoms are present. What is asymptomatic? Signs and symptoms are not present, but they are carriers. Tell me the chain of infection. Infectious agent to reservoir to portal of exit to mode of transmission to portal of entry to host. Okay, what is reservoir? Place where microorganisms survive, multiply, and wait to transfer to susceptible host. What are some frequent reservoirs for hospital-acquired infections? Healthcare workers, especially their hands, patients, equipment, and the environment. What are the two types of human reservoirs? Asymptomatic and symptomatic. What do organisms need to thrive? Proper environment, including food, oxygen, water, temperature, pH, and light. What's the ideal temperature for pathogens? 20 degrees to 43 degrees Celsius or 68 degrees to 109 degrees Fahrenheit. What is the ideal pH for pathogens to survive? 5 to 7. So what are some examples of portal of exits? Blood, skin, mucous membranes, respiratory tract, genitourinary tract, gastrointestinal tract, and transplacental. What is a major route of transmission for pathogens identified in the healthcare setting? Unwashed hands of the healthcare provider. Then equipment. Alright, portal of entry and portal of exit is the same. Acceptable host, we know what that is. All right, what are the 4 stages of infectious process? Incubation stage, prodromal stage, illness stage, convalescence. What is the incubation stage? The time interval between entrance of the pathogen and appearance of first symptoms. What is prodromal stage? The interval from onset of non-civic signs and symptoms to more civic symptoms. What is the illness stage? The interval when the patient manifests signs and symptoms specific to the type of infection. What is the convalescent stage? The interval when acute symptoms of infection disappear. What do normal flora do? They reside in the body. Where can we find normal fluid? Skin, saliva, oral mucosa, and intestinal walls. What may eliminate or change normal flora? Use of broad-spectrum antibiotics for treatment of infection. And what would this lead to? Superinfection. What is inflammation? A protective vascular reaction that delivers fluid, blood products, and nutrients to an area of injury, neutralizes and eliminates pathogens or dead necrotic tissues, and establishes a means of repairing body cells and tissues. What are the signs and symptoms of local inflammation and infection? Redness, heat, swelling, pain, and loss of function to the affected body part. What are the signs and symptoms of systemic inflammation? Fever, increased white blood cells, malaise, anorexia, nausea, vomiting, lymph node enlargement, and organ failure. All right. Leukocytosis, increase in number of white blood cells. Okay. All right. Tell me about serous exudate. It's clear like plasma. What does sanguineous exudate contain? White blood cells. What does purulent exudate contain? White blood cells and bacteria. All right. What helps prevent hospital-acquired infections? Hand hygiene and chlorhexidine wipes. What are the major sites of hospital-acquired infections? Surgical or trauma wounds, urinary respiratory tracts, and bloodstreams. What is an iatrogenic infection? From a procedure. So like bronchoscopy and treatment with broad-spectrum antibiotics. It's an exogenous infection. From microorganisms outside the individual. What's an example of an exogenous infection? Salmonella. What is an endogenous infection? The patient's flora becomes altered and overgrowth results. What's an example of an endogenous infection? Streptococcus. So broad-spectrum antibiotics, stuff like that. How does age play a risk for infection? The infant has immature defenses against infection. The young or middle-aged adult has refined defenses against infection. Older adults, immune responses, they decline against infection, in particular cell-mediated immunity. How does malnourishment play a role in infection? A reduction in the number of protein and other nutrients such as carbs and fats reduces body defenses against infection and impairs wound healing. How does stress play a role with infection? The body responds to emotional or physical stress by the general adaptation. If stress continues or becomes intense, elevated cortisol levels result in decreased resistance to infection. Continuous stress leads to exhaustion, which causes depletion of energy stores, and the body has no resistance to invading organisms. How do disease processes contribute to infection? Leukemia, AIDS, lymphoma, and aplastic anemia are conditions that compromise the host by weakening defenses against infectious organisms. Diabetes and multiple sclerosis impair nutrition and debilitate. How do treatments or conditions that compromise the immune response contribute to infection? Radiation lowers white blood cells and thins the skin, and then patients with burns have a high susceptibility to infection. Alrighty. Local infections are most common where? Skin or mucous membrane breakdown, such as surgical and traumatic wounds, pressure ulcers, oral lesions, and abscesses. And if these don't heal, systemic infections occur. What are some atypical symptoms of infection? Confusion, incontinence, or agitation. We need a meta history to identify medications that increase the patient's susceptibility to infection, okay? Lab values such as increased white blood cells or positive blood culture often indicate infection, but they're not enough to detect infection, okay? Plan implementation. So acute care involves eliminating the infectious organism and supporting the patient's defenses. So what are we trying to prevent with systemic infections? Complications of fever. What are we doing for local infections? Removing debris or promote healing. What is medical asepsis? Cleaning technique includes procedures for reducing the number of microorganisms present and preventing the transfer of organisms after an organism becomes unsterile or unclean is contaminated. Medical asepsis, an area or object is considered contaminated if it contains or is susceptible to containing pathogens. Standard precautions apply to contact with blood, body fluid, non-intact skin, and mucous membranes from all patients. What's the purpose of hand hygiene? Remove microorganisms mechanically. Hand washing does not kill them. Alright, when we're going to use alcohol-based hand rub? Before, after, and between direct patient contact, before putting on sterile gloves, before inserting invasive devices, after contact with body fluids or secretions, when moving from a contaminated to a clean body site during care, after contact with surfaces or objects in the patient's room, after removing gloves. Alright, how are we going to clean equipment? You're going to wear eyewear and goggles, so you're going to rinse the object under cold running water. Then you're going to wash it with soap and warm water. Then you use a brush to remove the dirt and material in the grooves. Then rinse again with warm water. Then dry it and get it ready to be cleaned. Dry it. Okay? What is disinfection? Removes everything except for bacterial spores. So using chemical disinfectant or wet pasteurization for respiratory therapy equipment. So what is sterilization? Removing everything including spores, so like steam under pressure, ETO gas, hydrogen peroxide plasma, and chemicals. ETO poses a risk to health to staff. And then you evaluate, see if everything's good. What's coughing etiquette? Cover your nose and mouth with a tissue when you cough and properly dispose of contaminated tissue. Put a surgical mask on a patient if it does not compromise respiratory function or it is applicable, which may not be feasible in pediatric patients. Hand hygiene after contact with contaminated respiratory secretions. Spatial separation greater than 3 feet from persons with respiratory infections. Alright, what is isolation? The separation and restriction of movement of ill persons with contagious disease. What are barrier precautions? Appropriate use of PPE such as gown, gloves, masks, eyewear, and other protective devices or clothing. What do you wear for contact precautions? Gown and gloves. What do you do for droplet precautions? Surgical mask and 3 people, a patient, proper hand hygiene, some dedicated care equipment. What do we do for airborne precautions? Negative pressure room, an N95 respirator room. What do we do for protective equipment? Environment, positive pressure room. Then we look at the psychological implications. Listen to them. When a patient has an airborne infection, he must wear a mask when leaving the room. Alright. What is surgical asepsis? It's used to eliminate all microorganisms, including spores and everything. When do we use surgical asepsis? We're going through the skin. When the integrity of the skin is broken. And then invasive procedures as well. What are the principles of sterile technique? Sterile object remains sterile only when touched by another sterile object. Only sterile objects may be placed on a sterile field. Sterile object or field out of the range of vision, or an object held below a person's waist is contaminated. Sterile object or field becomes contaminated by prolonged exposure to air. So like a bottle containing a sterile solution is sterile on the inside and contaminated on the outside. The neck of the bottle is also contaminated, but the inside of the bottle cap is sterile. When a sterile surface comes in contact with a wet, contaminated surface, sterile object or field becomes contaminated by capillary action. Sterile object becomes contaminated if gravity causes a contaminated liquid to flow over the surface of the object. To avoid contamination during a surgical hand scrub, hold your hands above your elbows. The edges of the sterile field or container are considered to be sterile. Okay. Let's talk about sleep. Alright, what affects circadian rhythm? Light, temperature, social activities, having a cool bed with appropriate ventilation, windows covered with curtains, essential oils, and fans. The circadian rhythm is like a biological clock. What's the major sleep center in the body? Hypothalamus. Tell me about, so phase 1 NREM is 4 stages, 80% sleep. What is stage 1 of NREM? Last a few minutes, falling asleep, that's light sleep. Sensory stimuli easily arouses a person. What is NREM stage 2? Last 10 to 20 minutes, heart rate slows, body temperature drops. What is NREM stage 3? Last 15 to 30 minutes, deep sleep, muscle tissue repair, delta waves begin. What is NREM stage 4? Last 15 to 30 minutes, deep sleep, muscle tissue repair, difficult to wake when sleepwalking and bedwetting occurs. This is where the majority of sleep takes place. Depth of sleep increases with each stage. Okay. Tell me about the Rem stage. So it's the phase at the end of each sleep cycle, around 20 minutes. This begins 90 minutes after sleeping has begun. Heart rate, blood pressure, muscle tone are lost. Breathing becomes more rapid and irregular. It's hard to wake them up. One sleep cycle is 90 minutes, and you have like 5 or 6 per night. So tell me the stages of the sleep cycle. So you're going to have pre-sleepiness, then NREM 1, then 2, then 3, then 4, then 3, then 2, then REM. Alright, what are the functions of sleep? Restores routine biological processes, release human growth hormone, protein synthesis, cell division. During REM, a person is able to restore brain tissue, so it is required for learning, conserves energy, and rest. Alright, how many hours a day do neonates, like birth to 3 months, sleep? 16 to 18 hours. How many hours a day do infants? 3 months to 2 years sleep. So 8 to 10 hours per night, and they have 1 to 2 naps per day, so it's 15 hours per day. How many hours do toddlers sleep? 12 hours per day, including daytime naps. How many hours do preschoolers sleep? 10 to 12 hours per day, no daytime napping. How many hours per day do school-age children sleep? 9 to 12 hours per day. How many hours do adolescents sleep? 7.5 hours, but they need 9 to 11 hours a night. How many hours do young adults sleep? 6 to 8.5, but they need 9 hours. How many hours do middle to older adults sleep? Just nighttime sleep declines as age increases. What factors promote and disrupt sleep? So like drugs, so like hypnotics, diuretics, antidepressants, stimulants, beta adrenergic blockers, and benzodiazepines like nicotine, opioids, caffeine, alcohol, work schedule, routine, stress, exercise, 2 more hours before bed, environment, light, noise. Okay. All right. No rest. Okay, what's restless leg syndrome? Recurrent erratic movement of the feet and legs. What is restless leg syndrome most common in? Women. Can be associated with decreased iron levels, pregnancy, and diet. What is peptic ulcer disease? Frequently awaken in the middle of the night. Inability to suppress acid secretion in the middle of the night, leading to reflux. All right, what is insomnia? Chronic difficulty falling asleep. Inducing insomnia, can't fall asleep. Maintenance insomnia, can't stay asleep. Got excessive daytime sleepiness. Symptom pointing to underlying disorder. Most common sleep disorder. Assess sleep hygiene. What is narcolepsy? Dysfunction of mechanisms that regulate sleep. You're going to have cataplexy. So med condition in which strong emotional laughter causes conscious collapse. You're going to have excessive daytime sleepiness. REM occurs in the first 15 minutes of falling asleep. Experience very vivid dreams and sleep paralysis. Tell me about sleep deprivation. Caused by illness, stress, and meds, nurses and patients are especially prone to this. Tell me about parasomnias. These are more common in children, so somnambulism, nightmares, nocturnal enuresis, and bruxism. Tell me about what is sleep apnea? Lack of airflow for at least 10 seconds. 3 types of sleep apnea. Central, obstructive, and mixed. What is obstructive sleep apnea? Upper airway becomes partially or completely blocked. What is the main symptom of obstructive sleep apnea? Excessive daytime sleepiness. What are the 2 biggest risk factors of sleep apnea? Hypertension and obesity. Alright, how do we treat sleep apnea? Weight loss, side sleeping, CPAP, limit alcohol, stop smoking. Alright, what's the Epworth Sleepiness Scale do? Assesses what the patient feels about their sleep patterns. What does the Pittsburgh Sleep Quality Index do? Tells how the patient is sleeping when they do fall asleep. This is sleep history. We're going to implement safety and stuff. Decrease stress, bedtime snacks. Sleep subjective, stuff like that. Easy peasy.